Cancer today?
Yes, ma'am.
Okay. So what is cancer? Basically, abnormal multiplication of cells is nothing but cancer beta. Okay.
Yes, ma'am.
So, and cancer can be basically of two types. We have benign and malignant. Okay. Tumor is the normal term what we use. So benign tumors are the tumors which are of like in early stages, okay, and which are confined to the place of origin, which did not spread much, okay. So suppose breast cancer is there, and if it is in initial stage, we call it as benign, okay, like small fibroids we say, right? So similarly, suppose if it starts spreading through lymphatic route, you will see they may be spread to axilla, they may be spread to ovary also, different organs. Suppose when it starts spreading, you call it as malignant tumor, and spread of tumors is nothing but metastasis. Okay. So basically we divide cancer into 4 stages, which you will be studying in pathology. Grade 1, grade 2, grade 3, grade 4. Grade 1 is nothing but benign tumor, which is actually localized to the place of its origin. Okay. And based on the nutritional availability to that particular tissue, and based on the number of cells, and based on how much it has spread, if it has spread to nearby areas, you call it as grade 2. Little far areas, grade 3. If it has extensive spread throughout the body, generally we call it as grade 4. And that grade 4 cancers are nothing but malignant tumors or cancers. Okay. Basically, the easiest route through which the cancer spread is lymphatic route, and the spread is called as metastasis. Okay. So initial or early stages, we use the word benign, and the advanced stages, we use the word malignant. Okay, and now we see like cancers have become very common in every family. In among at least 100 people, you see at least 10%, 20% people are easily dying because of cancers. That means among 120 people are dying due to cancer only. Okay, now because pollution has increased and junk type of food, so many factors are there. Whatever we are eating is not actually, though they call farm fresh, it's never farm fresh. Pesticides, herbicides, everything, so many chemicals are used in everything. So obviously we are exposed to so many carcinogens. Cancer causing agents are called as carcinogens. Okay? Mutations are caused suddenly, because of which cells will start behaving very much abnormally. It will start multiplying, and you will see cancers will happen. Okay. So we have actually cancer is neoplasia is an extensive chapter what you study in pathology beta. So there you see all these factors are given, no, that like it is around for 10 to 15 pages each. So cancer comes as an essay question there. Here only some few topics are important in biochemistry. Okay.
Yes, ma'am.
Now see here, physical factors. Just now I was talking like sunlight. If we are exposed to over sunlight also, UV rays make us skin cancer. There are many chemical agents. What I told you just now, like whatever we are eating is not safe. Pesticides, so many we use, urea and all, isn't it? All chemicals, they are actually responsible for, they are actually carcinogens, cancer causing agents. There are certain genes also which can cause cancers, that is genetic factor. Then we have certain environmental factors also. Okay, all these are the factors which can cause cancers, like chemical carcinogens. Almost 80% of human cancers are caused due to chemical carcinogens. You see what I was telling you. So organic chemicals, like so many inorganic, whatever we use in day-to-day life, for the production of food and everything, for the preservation of food, isn't it? Drugs what we use are not safe. So all these are actually chemical carcinogens. They actually change the cell cycle, and they will make the cell to multiply more, so that they will undergo carcinogenesis. That is, they transform into cancer forming cells. Sudden mutations may happen. Normally multiplying cell, now it becomes very much cancerous and it multiplies more. Okay. So generally there is a test called as AMS assay, which is lab test to check the carcinogenicity of chemicals. Okay. Generally in this test, bacterium Salmonella typhimurium is used. Okay. So if we find this bacillus is multiplying more than the normal culture media what we use, then it shows like that particular agent has cancer causing properties. Okay. So radiations, as I told you, UV rays which is existing in atmosphere, and basically ozone layer protects us from UV rays. Now because of pollution, we see ozone layer is also damaged. So that's the reason UV rays are now entering into our atmosphere and we are exposed to UV rays, leading to so many different types of skin cancers. Apart from that, X-rays, gamma rays, isn't it? So occupational hazards, radiologists are at high risk of getting cancers because of the exposure to high radiation. Even anatomy department people are exposed to much formalin, as you have experienced during your dissection classes, right?
Yes, ma'am.
So that is also very dangerous. That is also carcinogenic. So always occupation hazards are there. Okay, beta? So there are certain viruses also which can cause cancers, like adenoviruses. Among them, adenovirus 12 and 18. Similarly, herpes virus, Epstein-Barr virus, and so on. Okay, we have DNA. See, viruses can have genetic material, either DNA or RNA. If DNA is genetic material, we call them as DNA viruses. If RNA is genetic material, we call them as RNA viruses. Okay, with it? Then those are the carcinogenic viruses which you can give. That means suppose if we are infected with any of these viruses, especially cervix cancer in female, HPV, human papilloma virus is responsible for cervix cancer in females, which you will be again studying in pathology in female reproductive system. That comes as an essay question. Human papilloma virus. Okay. So there are certain RNA viruses also which can cause cancers like leukemia, blood cancer. Okay. So those are all carcinogenic viruses. So how do these viruses cause cancer? They take control over our genetic material. That means our DNA will be under the control of the virus, and the DNA will start multiplying under the leadership of this virus. So it goes on you will be studying again in microbiology and pathology in your next year, like how this virus will infect the cell and it will take hold on the genetic material of the host cell and it will cause the host cell to become into cancerous form. It causes its multiplication more than required. Okay. Then oncogenes. See, this is very important. But oncogenes is the repeated question which usually comes in biochemistry exams. So,
Yes, ma'am.
oncogenes, genes capable of causing cancer are called as oncogenes. Okay, you have a list here. See, whole of this list I want you to remember. If anything is
Yes, ma'am.
important in this chapter, is this only. So, oncoproteins. Okay, and proto-oncogenes are inactive forms of oncogenes which can cause cancer. And suppose if these proteins are oncogenes, like platelet-derived growth factor is present, the oncogene form is proto-oncogene. Associated tumor is osteosarcoma. So different types of genes are there, beta, which are responsible for cancerous transformation. I was talking like host DNA will have incorporation of bacterial DNA. It can be either viral DNA. Okay. Viruses will have only genetic material. They cannot multiply on themselves. They need some living host for their multiplication. So suppose if human host is attacked, then our cells will act very much differently. Okay. So much confusion will be arised in the cells, that chaos will be there and abnormal multiplication we find. in human cells once it is attacked by viruses. Growth factors are never asked, but
Yes, ma'am.
several growth factors stimulating the proliferation of normal cells are known. That means these growth factors are also one of the reasons for the cell to multiply more than normal, Shubhangi.
Yes,
As
ma'am.
long as these growth factors are available, cells will multiply more and they can transform into cancerous cell. The cell proliferation is stimulated by growth factor. Of course, that is, as long as this mechanism is normal, we do not suffer with any disease. But suppose if they are excessively available, receptors are also available, then it may happen. Okay. So here it's given in a very simple tabular form, like for example, epidermal growth factor. It is released from salivary glands and the fibroblast cells. The functions are it stimulates growth of epidermal cells, covering cells. Isn't it? Surface cells, they are called as epithelial cells. So as long as they are present in normal amount, normal proportion, only normal epithelial cells will grow. Normal epidermal cells will grow, but suppose if they are like released more and our body is responding more, then it may lead to a cancerous type of change. Anything, like so many examples are there. Actually, anti-oncogenes are protective genes better. They are good, in fact. As long as these genes are available, what happens is our body is well protected. Okay. And we do not suffer with cancers. For example, cancer suppressor gene, P53 gene, a special category gene called as cancer suppressor gene or more commonly anti-oncogene have been identified. Okay. As
Yes,
long
ma'am.
as P53 is available, we are safe. Okay. But
Okay,
certain
ma'am.
carcinogens, they suppress P53 anti-oncogene, because of which our cells will behave abnormally and they will.
Abnormal.
Okay.
Yes, ma'am.
Programmed cell death is of course apoptosis. Tumor markers are very, very important, beta. Suppose if a
Yes, ma'am.
person is suffering with cancer, he is only suspecting, like it's screening test in the sense it's always better to get our test done once in a year. Once in a year, at least once after we reach 40 years, after crossing 35 to 40 years, we get all tests done, isn't it? That is actually useful only because any disease which is in early stage can be detected. So similarly, cancers also can be detected with the help of certain chemical substances released in the blood. Okay, such chemical substances which are giving an indication or hint like a person may be suffering with cancer, you call them as tumor markers. Okay,
Yes, ma'am.
so like that we have many tumor markers. For example, if a person is going to suffer with colon cancer or stomach or lung cancer or pancreas or breast cancer, you will see carcinoembryonic antigen CEA is increased. Cancer of liver, germ cells or testis, you will see alpha fetoprotein levels are increased in the blood. Okay, similarly, I want you to memorize this entire table because this is very, very important. It's
Yes, ma'am.
again routine question, tumor markers and associated cancers. Cancer therapy, generally that means what is the treatment which is usually given to treat cancer. We have generally, first thing is, it all depends on like what stage the cancer has been detected. Okay, I'll tell you in general first. So basically we start in early stages, chemotherapy itself is enough. I told you we have 4 different grades and stages of cancer. If it has been
Yes.
detected in a very early stage, generally chemotherapy is sufficient.
Both.
We give anti-cancer drugs, okay, and we generally monitor the patient, and generally we see it is highly successful. Okay, but unfortunately, if the case has been detected in stage 4, where extensive metastasis has already occurred, in such case, what we do is surgical intervention is done. Okay, suppose if it is breast cancer, completely mastectomy is done, that is the removal of breast. Or suppose if it is cervix cancer, which is again very common. Breast cancer in females and cervix cancer, they are #1 killers, isn't it? So suppose if it is cervical carcinoma, what we will plan? We will plan hysterectomy, complete removal of uterus. Along with that, we will also undertake chemotherapy and radiotherapy. Chemotherapy is we will be giving certain anti-cancer drugs, followed by radiotherapy. Radiotherapy in the sense we expose the patient to certain radioactive rays, which will kill the cancer cells which have been extensively spread in the body. But what happens is, unfortunately, those radiotherapy waves, they actually rays, they not only kill the cancer cells, but also kill normal cells. That's the reason uh, cancer patients, you should have seen, they become very weak after this treatment. They lose hair, isn't it?
Yes, ma'am.
Yeah, so much very dangerous beta cancer. You treat also, it's a problem. You don't treat also, it's a problem. It's very difficult to lead a life if it is 4th grade cancer. Okay, beta. So these are anti-cancer drugs we have. So like methotrexate. So it is folic acid analog. It blocks the formatting of tetrahydrofolate, inhibits. That means one carbon metabolism is being blocked beta. As long as carbon is available, cells will nicely multiply, no?
Yes, ma'am.
So like that, we are just preventing in the cell cycle. We are trying to prevent, like
Prevent.
purines are not made available. We are making use of certain antibiotics like mitomycin, actinomycin. We are making use of certain alkaloids. Okay, platinum. So many different type of things we can make use and try to prevent cancer. So all these are anti-cancer drugs. This is again helpful for you even in pharmacology second year. There also you have a chapter cancer. There you will be getting a short note like what are anti-cancer drugs. You also get what are the antibiotics which are used to prevent cancer for 2 marks, something like that. So that is all about cancer, beta. Okay, just
Yes,
go
ma'am.
through the question bank and check what are the questions which have been given.
Question.